Hi, my name is Scotty Thomas. I'm one of 4 nurse practitioners that works very closely with Doctors Kilgore, Kimball, and Boone. And I am going to be talking about your preoperative process as well as the operation day itself, and then postoperative and home care. So thank you all for listening. And if you have any questions regarding anything we talk about during this presentation, you can give our office a call at 865-305-5622. First, we're going to talk about the anesthesia pre-op testing. So this pre-op visit is a very important appointment that you'll need prior to surgery. In fact, it's so important that if you miss this pre-op testing appointment, it might either delay or cancel your surgery. So basically, this appointment is good for 1 month. So if you've previously had an operation such as a DNC or something within a month of having your surgery, then that should count for that operation. But if it's been longer than a month, then you will need an additional pre-op appointment. So the purpose of this visit is to ensure that you are safe during anesthesia and surgery. So essentially what they do there is they'll perform a thorough history and physical, as well as any additional testing that they might recommend based on your overall health, age, and any additional medical diagnoses that you might have. So some additional testing that they might recommend could include x-rays, EKGs, or any additional lab work that they need prior to the surgery. Typically, this appointment lasts about 1 to 2 hours, and you want to make sure that you bring a list of your medications, any allergies, and any previous surgeries that you have had, so that they can make sure that they have all that information. So we'll move on to the day of surgery. So when you come in, your physician will come and speak to you prior to surgery. That'll be a good opportunity to ask any additional questions before you go to the operating room. Length of surgery will vary depending on any complexities, any findings at the time of surgery, and whether you have to have an open procedure versus the robotic procedure with those smaller incisions. Now, a lot of people have questions about the urinary catheter. That's placed after you're already asleep, so you won't have to be, you won't be awake for that. And then it'll be taken out when it's appropriate. Now, Doctors Kimball, Kilgore, and Boone, they'll come and speak to your family following the procedure, as you'll still be kind of sleepy from the anesthesia. They'll go over any findings that they find at the time of surgery, share with your family, and then you probably the next morning or when you're more alert. Following that surgery, you'll either be moved to a regular room or possibly ICU if you need any closer monitoring. Moving to the ICU is a little bit more rare. Usually it's a regular room because everything went well and you're recovering well. And then the time of completion from being moved to from the PACU, the post-anesthesia care unit, to a regular room is usually about 2 to 3 hours. And then your family will be able to see you once you're moved to that regular room. Because when you're in the PACU, it's not helpful for them to come back because you're still pretty out of it. Length of stay can vary depending on what type of procedure you have. So the laparoscopic or that robotic procedure, where you have 4 to 5 smaller incisions, typically it's a 1-day stay. If your surgery is early in the morning and you're recovering well, then a lot of times you'll get to go home the same day, but usually it's an overnight if you have to stay at all. And then those open surgeries where you have that larger incision down the abdomen, usually it's an average of 5 days, but it can be anywhere from 5 to 10 days depending on your progress and recovery. So all 3 of our physicians do rounding early in the mornings between 6:30 and 8:30. So if family members have questions, that would be a good time for them to be there and have those questions available. So now we'll talk about home care. So you will have either those little incisions or a large incision. It is important to keep all of your incisions as clean and dry as possible. You'll have steri strips or staples, depending on what procedure you had. We don't want you submerging in any water, so no baths, no getting in the pool or the lake or anything like that until we release you to those activities, but showers are okay, and you just want to let warm soapy water run over those incisions. The steri strips typically will fall off after about a week, so those are those little bandages, but we want those on as long as they're clean and functional. And usually by the first post-op visit, if they're still hanging on, then the nurse practitioners will remove them. Now, if you have staples, the nurse practitioners will remove those at the first post-op visit, and usually that's between 9 to 14 days after the surgery. But that appointment will already be set when you know when your surgery is. You do not need to keep the incisions covered unless you've been directed to do so. So the big square bandages that they put over the little incisions, you can take off, but leave the steri strips, and then we'll remove those at your first post-op visit. A lot of people have questions about when it's okay to drive, and typically what we say is if you are not taking any of the opioid pain medications, and as long as you feel like you could react quickly from if you needed to stop quickly, because we don't want any pressure on the abdomen, which could increase pain. We do want you refraining from any bending at the waist, squatting, twisting or pulling motions, or anything that's going to put extra pressure on the abdomen. And really that's because we want to make sure that internal vaginal incision, if you have one, we want to keep it safe and let it heal appropriately, and avoid anything that can open that up. So that's no lifting over 10 to 15 pounds. Stairs are okay as tolerated, so you can go up and down stairs, but if anything starts to hurt or cause increased pain, then I want you to kind of slow down. And then you'll need to maintain pelvic rest for 6 weeks or more. It depends on what the incision and the pelvic exam looks like at your second post-op visit. So that means nothing in the vagina until we release you back to that. So no intercourse, no douching, no tampons. You may have some vaginal spotting or bleeding after surgery, and this can be a normal part of the healing process up to 6 to 8 weeks out from the surgery. Now, if you have heavy vaginal bleeding, are passing large clots, have acute pain and bleeding, then you need to call, but spotting is very normal. So like I said, those red flags would be heavy bleeding, whether you're saturating greater than 1 pad an hour, or bleeding associated with pain or any clots. And then we certainly want you to call us with any concerns, especially bleeding like we just talked about, any fever greater than 101, pain that is worsening and not getting better, any vomiting, shortness of breath, or if you've not had a bowel movement in over 3 days. Constipation is one of the most common things that we get calls about post-operatively, and it's related to a couple of different things. One, any abdominal surgery is going to slow down the gut. Anesthesia further slows that down, and then if you're taking those opioid pain medications, then it slows it down even further. So it's very important to be on a good bowel regimen, and we will, before you leave the hospital, they will give you stool softeners to take, and I would recommend taking those for sure. And then you can add in Miralax, which is that powder laxative, 1 to 2 times a day if you need it. And then, of course, if you go, more than 3 days without having a bowel movement or having increased pain when trying to have a bowel movement, then call our office. Another complaint that we get, it's probably one up there with constipation, is bladder pressure and discomfort when you're urinating. Feels maybe very similar to a urinary tract infection, but it's rarely a UTI. It's just from where the bladder was kind of manipulated at the time of surgery. You can get some irritation there. Typically, we recommend taking over-the-counter Azo tablets, that's AZO, and that helps kind of calm down those bladder spasms. It's over the counter. It can turn your urine kind of a bright orangey red color, so don't panic if that happens. But certainly if your symptoms are not getting better or they're worsening, then call us and we can always check a urine sample to rule out a urinary tract infection. So your first post-op appointment will be with one of the nurse practitioners. This will be about 2 weeks post-op, sometimes a little bit sooner if you have staples, so that we can evaluate and possibly remove those. At that time, we'll review any post-op symptoms you're having, any concerns that you're having, and then if the pathology report is available, we'll go over that at that time, as well as planning for any additional treatment if it's recommended or necessary. If your plan going forward does include chemotherapy, we will do extensive chemotherapy education at that first visit. And it's a good idea to bring someone with you, a family member, friend, because it's a lot of information at one time with that chemo education, and it's good to have more than one set of ears. And then we will also, at that appointment, set you up for your next post-op appointment on that day. Let's see here. If radiation therapy is recommended, that would not start until after your second post-op visit, because we want to make sure all of your incisions heal really well before starting radiation therapy. So we'll kind of make that call and talk about that at the first post-op visit. We will not typically do a pelvic exam at the first post-op visit. We'll usually wait until the second one, unless you're having any issues that warrant a pelvic exam. And then the second post-op visit, so this will be with both your physician and a nurse practitioner. The incisions, the abdominal incisions, we'll reevaluate on that day, and then we'll also do that pelvic exam to make sure that internal vaginal incision has healed well. As long as it has, then you'll be back to all of your normal activities. And then we also, like I said, if your plan includes radiation, we want to make sure that that incision is really well healed before we refer you to radiation oncology. We will provide additional education about your pathology, diagnosis, review any additional treatments if recommended. And typically chemotherapy can start as soon as 4 weeks after the surgery, depending on how you're recovering. And then, like I said, if it includes radiation, that's usually at least 6 weeks after the surgery, and most of the time it's a little bit longer than that. So I will move on and move this over to our supportive services. So Terry Freeman is our social worker. We do have that available here as a resource at the Cancer Center. She is able to provide individual counseling for patients and family members, information on support groups, speaking with children about cancer diagnoses if that's something that you're dealing with, and also some resources. One is called the Woman-to-Woman program. That's an individual peer support / mentor program for those diagnosed with a gynecologic cancer and would like to speak with someone who's been through a similar diagnosis and treatment plan. She also has information on advanced directives. She is a notary, so she's able to notarize any forms that you might have. And then she also has a lot of information about community resources, including transportation, home care services, free wigs, and just she's a wealth of knowledge. So she is available by appointment or phone call, so we can get that set up. And then I'll pass it on to our financial counselor.
My name is Brandy Russell. I am one of 4 patient financial advocates here for the Cancer Institute. Our office specializes in helping you with your financial journey through the office. We have different resources available, whether it be financial assistance through the hospital, copay and foundation assistance for different types of chemo drugs, any type of medications, we can always inquire about. If you have insurance, fantastic. We can get you partnered with programs that will help you pay those co-pays. If you don't have insurance, we can work with you, work with the hospital to get an assistance plan set up. We can make referrals for you to talk to someone who could potentially help you get set up with insurance. And then we also are happy to discuss any type of disability. If you want to file for disability, we can help you through that. If you have cancer policy, insurance policies, we're happy to get you those documents that you'll need for reimbursements. If you have any questions about out-of-pocket expenses for your surgery, we're happy to discuss that with you. Our phone number is 865-305-7971. And you can contact us by phone, or when you come in, you can also let someone know that you want to be seen. And we'll be glad to come meet with you.
All right, next I'm going to talk about our oncology certified dietitian we have here at the Cancer Center. She is available also by phone or appointment, and her name is Kathy. So she is available to assist with any nutrition needs throughout your care. And that's mostly if you're having to receive any additional therapy, chemotherapy, or radiation. There is a dietitian in the hospital that helps with kind of that perioperative. So after your surgery, if you have any questions or concerns, a dietitian is available in the hospital for those services. But Karen is available for any help with side effect management during chemo and or radiation, and any nutrition for survivorship after you're finished with treatment. We also have integrative healthcare services here. It provides individualized options for stress management for patients, family members, caregivers, and staff. So they offer a variety of services, including yoga, acupuncture, massage therapy, music therapy, and body stress reduction. Typically those appointments, you just make those appointments, and all of the services are about $1 a minute. So if you do a 30-minute session, it's $30, which is really a nice option. And then our GYN support group is called the Bells. They meet every third Thursday from 5:30 to 7 at UT, and that's typically a meeting with another support service or community service worker to do a little bit more education. And then they also meet one Saturday a month for kind of a social event. So these are all ladies, GYN cancer survivors, that meet together to just have fellowship, kind of help spread awareness to the community about GYN cancers, and just meet together and, you know, they have a good time supporting one another. So thank you for listening into this education class. And again, if you have any questions about anything that you heard on this presentation, just give our office a call at 865-305-5622.